Another day, another story. Cough syrup as a drug. Cough syrup, commonly found in most households as an over-the-counter medication, serves a dual purpose. While its primary function is to alleviate coughing and related symptoms, it also has the potential for abuse due to the presence of active ingredients that can induce altered states of consciousness. This chapter explores the various aspects of cough syrup as a drug, including its history, active ingredients, effects, risks, and potential for abuse. The history of cough syrup. Cough syrup, in various forms, has been used for centuries to alleviate coughing and cold symptoms. Ancient civilizations, such as the Egyptians and the Greeks, used concoctions containing ingredients like honey, herbs, and other natural remedies to ease coughs and respiratory discomfort. The modern version of cough syrup as we know it today began to emerge in the 19th century when pharmacists and doctors started to develop more standardized and effective formulations. Active ingredients in cough syrup. Cough syrup typically contains a combination of active ingredients designed to address the symptoms of coughs and colds. The primary active ingredients in cough syrup are antitussives. These are substances that suppress or control the urge to cough. Common antitussives include dextromethorphan, DXM, and codeine. Expectorants. These substances help loosen and thin mucus in the airways, making it easier to expel. Guaifenesin is a common expectorant found in cough syrups. Decongestants. Decongestants like pseudoephedrine or phenylephrine are included in some cough syrups to reduce nasal congestion by constricting blood vessels in the nasal passages. Effects of cough syrup. When used as directed, cough syrup can effectively alleviate coughing and related symptoms, providing relief to those suffering from respiratory illnesses. The effects include cough suppression. Antitussives like DXM and codeine can effectively suppress cough reflexes, providing relief from persistent coughing. Mucus clearance. Expectorants help thin and loosen mucus, making it easier to clear from the respiratory tract. Decongestion. Decongestants reduce nasal congestion by constricting blood vessels in the nasal passages, facilitating easier breathing. However, the active ingredients in cough syrup can also induce side effects, especially when used inappropriately. These side effects may include drowsiness, dizziness, dry mouth, and nausea. Risks and potential for abuse. While cough syrup is generally safe when used as directed, there is a potential for abuse and misuse due to the psychoactive properties of certain active ingredients, particularly dextromethorphan, DXM. DXM, when taken in excessive quantities, can lead to hallucinations, dissociation, and other altered states of consciousness. This has led to a concerning trend of recreational abuse of cough syrup, known as robotripping. The risks and potential for abuse associated with cough syrup include dependence. Prolonged misuse of cough syrup with DXM can lead to psychological dependence. Health risks. High doses of cough syrup can result in serious health risks, including seizures, high blood pressure, and even death. Legal consequences. The misuse of cough syrup containing restricted ingredients like codeine or pseudoephedrine can lead to legal consequences. Cough syrup is a valuable and widely used medication for alleviating cough and cold symptoms. However, it is essential to use cough syrup responsibly and only as directed by healthcare professionals or as indicated on the product label. The potential for abuse and misuse, particularly in the case of DXM-containing cough syrups, underscores the importance of educating the public about the risks associated with inappropriate use. Healthcare providers, parents, and individuals should be aware of the potential dangers of cough syrup as a drug and take steps to prevent its misuse.